transition. But
Yeah.
okay.
It's time for the Kim Hammer Show, where you'll learn how your state government affects you, your family, and community. Here's Kim Hammer.
Good Saturday afternoon. Thank you for taking time out to join in to the Kim Hammer Show. I will tell you, we're going to have some documents that are going to be put up on the Kim Hammer Show website regarding some of the information we'll talk about today, about an audit report that came out yesterday that we went over. You can go up to the KimHammerShow.com and get on the website and look for the report from the Legislative Audit that came out yesterday and we reviewed in the Legislative Audit Committee. In fact, that's the first thing we're going to be talking about today is the report that came out on the PBMs. It was asked for, I believe, by Senator Jason Rapert, and it came out yesterday. And we're going to go over that today to give you some insight about what we're doing. And then in the second half of the Kim Hammer Show, we're going to have Dr. Childers on, and we're going to be talking about unemployment, about the $300 going away at the end of the month, and just talk about some of the unemployment issues here in the state and also opportunities for employment here in the state. And that'll be on the second part of the Kim Hammer Show. One thing I want to do is give a plug to Wings Over Bryant. That's going to be on Saturday, June 19th. That is Father's Day weekend. It's a great event. It'll be from 10 to 2 o'clock. You can go up to the Bryant Chamber of Commerce website, get all the information regarding it. We'll have a radio plug here in a minute for them, but go ahead and remember Wings Over Bryant on June 19th there at the Saline County Airport located in Bryant. All right, joining me today on the Kim Hammer Show, I've got the managing attorney, Booth Rand, with the Arkansas Insurance Department that's joining me on the Kim Hammer Show, and then I have John Vinson, who is the CEO of the Arkansas Pharmacists Association. And gentlemen, we had a pretty thorough, what I would regard as interesting report that came out from Legislative Audit. Let me just ask each of you initially, what was your first reaction when you saw the report that came out? And then we're going to go into the details of the report. Let me appeal to you first, John, and then we'll go to Booth after that.
Sure. Thank you, Kim. Appreciate you having me on the show today. As the exec for the Arkansas Pharma Association, we represent the practicing pharmacists across Arkansas, nearly 2,500 pharmacists in all 75 counties. And when I saw the report this week and heard the presentation today, I was very impressed at how thorough it was. It had in-depth explanation of how insurance and pharmacy benefit claims actually work, and a lot of interesting information, a lot of things that our members have been testifying for years that drive up prices for consumers and taxpayers, while at the same time making it more difficult for the pharmacists to provide care or even stay in business in the local communities where they serve patients. So there's a lot of sunshine that was presented in this report that validated some of the testimony we had previously used. In fact, one of the bills that you sponsored in 2019, this report did validate a lot of the things that were testified with actual legislative audit that led to changes in state law to protect our citizens.
Booth, how about you?
Yeah, and I agree with John. I think to the uninitiated, I mean, when you read this report, I think it's 91 pages long, and that doesn't include exhibits. It's complicated. This is a complicated area of regulation. And as John pointed out, I think the legislative audit has shined the light on a lot of practices that have been prohibited now for the last year and a half since the report. So we're making progress at the state level in regulating PBMs and eliminating practices that have been predatory, such as spread pricing and reconciliation clawback and some other things that the legislative audit report mentioned. But I do caution people who read the report that it takes a little bit of knowledge and experience to understand all the acronyms related to PBMs, but quite a good job by legislative audit, in our opinion.
And it is complicated. So let me ask you, because Booth, you represent the Arkansas Insurance Department, and that means you represent the interest of Arkansans when it comes to the insurance department. In fact, I'll give you a few minutes in a little bit to kind of talk about what consumers need to know about how they can interact with you, and if you want to take this as a platform to just kind of educate them a little bit. But, and John, you represent the pharmacists. This report is kind of in depth, and it might be good reading material if you want to go to sleep kind of report. But is it confusing, or is it complicated by design, or is that just the nature of the beast? Because as I sat there yesterday and I listened to the report as it was being presented, and having been somewhat familiar with, this item, it's still hard to absorb. Why does it have to be so stinking complicated that we got to have a PBM in the middle?
Yeah, there are prohibited practices that are outlawed by Arkansas law due to a lot of changes made by the Arkansas Pharmacists Association. John's mentioned the clawback. There's negative clawback. There's reconciliation clawback. There's all kinds of terminologies or acronyms. If you're not really initiated into regulation of PBMs, you're going to have to go look it up. The good news is the Pharmacists Association and the Insurance Department works together. And for consumers or pharmacists, particularly pharmacists that are having problems with their reimbursement or with maybe engaged, have a PBM engaged in certain prohibited practices, the Arkansas Insurance Department is a point of contact. The pharmacist can go look at the Arkansas Insurance Department website, and there should be a link to the legal division. And so we receive and process pharmacist complaints every day about reimbursement and some of these practices. So it is complicated, but the good news is there are regulators now that are have educated themselves with respect to most of these practices, which we're familiar with. So the consumer doesn't need to know everything, but to read this report, you need some background. And I just want to sort of throw out the fact that the Insurance Department has been involved the last 2 years in some of this, and so we are trying to stabilize the market, and each year the legislature passes new legislation to help try to curb some of these abuses, and so trying to do the best we can.
Well, and I used the analogy yesterday in the committee meeting. It's kind of like a cat and mouse game, or it's like a chess game where, we make a move, they make a move, and the reality is, at the end of the day, we want to checkmate to be able to hold them accountable. When you look at what the report highlighted on the front page, again, you can go up to the KimHammerShow.com website, and you'll be able to get access not only to this report that came out, was a special report, but also there was a special report on the Arkansas State and Public School Employees Health Benefit, because that's an ongoing issue as well right now with the cost of insurance going up and having to make some difficult choices and looking at the overall plans of the state employees and the public school teachers employees. But you can get both those report on the KimHammerShow.com website. When I look at the front page, though, of the review of the selected financial records of state funding for the pharmacy benefit managers, the report highlights shows on the front page that in Arkansas, pharmacy benefit managers are primarily regulated by the Arkansas Insurance Department. One of the things that was brought out in the committee meeting yesterday is that there was a law, and I believe you spoke to it, Booth, that Percy Malone, I think it was Percy Malone, correct me if I'm wrong, passed in 2009, where we could have at least been having some leverage over the PBMs. Speak about that law, and I know it's not under your jurisdiction, but at least enlighten people that this goes back to 2009. What did it do?
Senator Percy Malone, in 2009, when he was in the legislature, passed a law. I believe it was called the Fair Disclosure Act. John may be able to correct me on that. It's called the State-Funded Fair Disclosure Act, which basically said that for PBMs engaged in business with state-funded health plans, they've got to pay the pharmacists what they're charging the plan. There can't be any spread pricing. And so that law was put under the jurisdiction of the Attorney General's office, not the Insurance Department, in 2009. So from 2009 until the Insurance Department took over full jurisdiction of spread pricing, it's largely been unregulated. But the law, as you indicated in your testimony today, has really not been enforced. And so now since 2016, 17 and 18, the Insurance Department prohibits spread pricing. But there is an issue about whether or not the 2009 to 2016 whether PBMs were permitted to engage in spread pricing with state fund plans in light of that law. So that was some discussion this morning. So it's a question for the Attorney General's office, but the insurance department, right now prohibits spread pricing as well as clawback and some other things. But the question is whether in 2009, whether it was prohibited or not, is up to the AG's office.
Just real quick, give a quick 3-hour degree program in 1 minute or less about spread pricing so people understand what you're saying about spread pricing.
Sure. For the simplest level, spread pricing is simply where the PBM pays a pharmacist what it does not charge the health plan. And so what it charges the health plan may differ from what it actually pays the actual pharmacy for a drug. So it may keep the difference. And so the difference is called spread. And we have prohibited that for the last maybe year and a half. And so it's been a pernicious practice and activity by the PBMs that the Arkansas Pharmacists Association and others have made efforts in the legislature to try to prohibit, and which we're doing right now.
All right. Tell you what I got to do, and then, John, I'm going to let you come back and comment on that, but we need to take just a quick break because I want to give a plug for Wings Over Bryant that's coming up on June 19th. So we'll be back in about 30 seconds on the Kim Hammer Show.
The largest air show in the South is coming to Bryan, Arkansas. Mark your calendars for the Arkansas Heart Hospital Wings Over Bryan Air Show, June 19th at the Saline County Regional Airport. Featured acts include the high-flying Team Aeroshell, the Bulldog Formation Fly Team, and the 24,000 horsepower jet truck Aftershock. Tickets on sale at all Central Arkansas Big Red stores for only $15, and kids 12 and under get free gate admission. Visit wingsoverbryan.com for more information. It's the Arkansas Heart Hospital Wings Over Bryan Air Show, Father's Day weekend.
All right, welcome back to the Kim Hammer Show. And as the ad said, you can go to the Big Reds here anywhere in Central Arkansas. If you can't find a Big Red, it's like saying you can't find a Dollar General. You probably don't need to be driving, okay? So get your tickets at the Big Red store for the Wings Over Bryant. All right, John, let me come back to you and just give you a chance to kind of respond or contribute to what we were talking about before on the spread pricing. Then I'm going to go on to the next question.
Okay, so super quick, you asked if it was complicated on purpose. I'm just going to refer to the U.S. Supreme Court Chief Justice John Roberts back in October of 2020 when the Supreme Court for the first time ever heard this issue at the highest court in the land. And he said it's not the pharmacy's fault that the pharmacy benefit managers who work for the insurance company have such Byzantine procedures. And for those of you who may not know what Byzantine means, it means excessively complicated on purpose. And if you look at that report on page 3, there's 8 ways this industry produces $500 billion of revenue as a middleman for profit as opposed to providing care in the community. So I think it's complicated on purpose to hide profits for middlemen instead of delivering patient care. So yes, I think it's totally on purpose. And this audit highlighted a lot of those areas, and it gives very clear information to policymakers on what they want to do about it. Back to the 2009 law versus the 2019 law, 10 years of history there. That original law still allowed spread pricing, but the legislative intent was that if they were going to do it, they had to clearly disclose it to the state, and then the state could decide whether they wanted to allow it or not, right? But it also said if they don't disclose it and it's found out that they were doing it, that full amount of the dollars is supposed to go to the pharmacist for that care they delivered, not stolen away in a manner that was not allowed under that law. That's our position on it. Well, I know there's ongoing conversations about that.
I did ask Legislative Audit yesterday to go back and determine what that dollar amount was, because if the law was in place and if they did a chess move to move around it, but yet they were expected to report that and they didn't report it, in my opinion, and that's all it is my opinion, then that would be a reason to go after them to make them pay back that difference. Because if the law said, if you do it, you got to report it, and they didn't report it, why would you not have a legal case against them because they didn't do what the law said?
And in fairness for your listeners, in 2019, I think you and a lot of your colleagues recognized that chess moves were being made to maybe find loopholes around existing laws. And instead of making it, you can do it under these circumstances, in 2019, the legislature just made the practice illegal, period.
All right.
enforceable under Booth Rand's division or under the commissioner's division.
Booth, you got any weigh in on that?
No, I think the legislature got sick and tired of, listening to the discussion about spread pricing and frankly prohibited in 2019. There is still the issue, though, of that 2009 law, what it means, and whether the PBMs were flagrantly violating that law. So we'll be interested to see the response to that research, and I'll be obviously interested in knowing what the conclusion of that will be as well.
So let me ask you, you made a comment a while ago, and I know Obamacare factors into some of this. You made the comment that the PBM actually works for the insurance company. Did one of y'all state that, or did I just get some bad echo effect in my?
John did, and they are they are hired as administrators for the health benefit plans to administer the drug plans, the prescription drugs for the health benefit plans. And so, the history of the PBMs, and John knows way more than me about this, but if you look at the history of the pharmacy benefit managers, when they were originally established, 30 years ago or 40, they simply provided claims adjudication services or electronic claims services for pharmacies and for health benefit plans. Many of the health insurance plans no longer wanted to do in-house pharmacy claims adjudication. And so they simply create companies. Companies were created that did software to help process claims for health benefit plans who no longer wanted to do in-house prescription drug adjudications. And so the original history of PBMs was good. They were to provide services and administrative services to pay claims at point of sale for pharmacies and health benefit plans to help improve and make sure things went through quickly. And so that their role was just simply as what we call a third-party administrator, or TPA. That's changed. Now they're engaged in all kinds of additional activities, and John can address that. But I think we've watched the transition of PBMs going from just simply claims adjudicators and claims assisters to engage in spread pricing and doing a lot of arbitrage over prescription drugs.
Every time we have these conversations, kind of get my creative juices going a little bit, and I guess what I'm wondering is, what would prohibit us from requiring, legislating, or creating the opportunity through legislation that the PBM works for us instead of the insurance company, so that we have tighter control, or maybe get them working for us instead of for the insurance company?
Well, I think John can address this. Gets into the issue of whether there should be legislation imposing a fiduciary duty, which is a duty to the consumer from the PBM. John, you might want to address that issue. I think a lot of it, Kim, we've had so many other things going on to address fiduciary duty. We've not really presented that issue yet in the legislature, but I think John could probably address that.
And I think there's still a discussion of whether that is to the insurance company or employer, or if that's to the individual patient that's, in that particular insurance. So there's a lot of policy decisions that could be discussed around that. But I would also say and this was included in the report, that some states have made it, passed laws to require fiduciary responsibility. If we did that, I would caution you, back to my point about representing pharmacists, that it's great to require them to have fiduciary duty to lower costs and to provide a good plan and ensure that the savings go to who they should go to, and that is to ultimately the consumer who purchases these services. But you also need protections in place to make sure they're not arbitrarily using their size as a monopoly to pay local pharmacists below their cost to deliver the services, but at the same time paying pharmacies that they now own because they're vertically integrated, and they may be owned with and by an insurance company and a retail or mail order pharmacy, and steering patients away from their local community to a pharmacy they don't even want to use, or to somebody they don't trust. So it's a complicated issue, but we certainly need to look at it closer.
Okay. On the getting back to the audit, because we kind of drifted, but I enjoyed the conversation. Getting back to the audit, one of the things it said was that audit report that AID, Arkansas Insurance Department, received a total of 237 PBM related complaints in 19 and 20. with the majority being resolved as of the report date. Booth, how many did you receive before the 2019-2020, or were you in a position that you even had to record them, and maybe you can't answer that?
I less than 100, Kim, probably. And as we got more and more jurisdictions from the state legislature, we got more and more pharmacies that participate more with us in filing complaints. There is an education issue with respect to pharmacies wanting to use the insurance department to help improve their compensation and to file complaints against PBMs. I mean, some of our job is to try to encourage more of that communication. There's I think, somewhat of cynicism about pharmacists. Oh, good, what good would it do? It'd just be another governmental agency that won't help me out after I fill out all these forms. And so there's some cynicism that we've got to get over and to allow the insurance department to start doing its work. I know Margie Farmer, who is our PBM coordinator, has in the last 2 years processed adjustments that equal several $100,000 in total for pharmacies that need adjustments to compensation and reimbursement because there have been violations of the law. So not very much at first, Kim, but now we're getting 200 or 300 a year.
All right, and that just, I remember a conversation when all this started back several years ago. One of the factors was the fear factors that some of the pharmacists were having, that if they did call and if they did report, that PBM could just honestly walk in and just terminate the contract, and they would be out of luck.
And the cynicism that what really good is it? Am I going to get immediate result from government bureaucracy? Because when they look, they're already in the middle of a bureaucracy with the PBM, who has put them through the rigors of their bureaucracy. And so to ask the pharmacy to now fill out more forms and send it to a state agency to get relief is asking a lot of them to do a lot of work and resources that at the end of the day, they may just not be willing to do. So part of our job at the insurance department is trying to encourage pharmacists to reach out to us so that we can actually pursue violations, and we encourage that contact. And I'm trying to get over the stereotype that we're just an agency that just sits around and doesn't do anything with respect to these complaints, because we do make adjustments, and we do get some of these complaints resolved.
John, do you have anything?
Yeah, I wanted to just from the pharmacist point of view, to make this real for your listeners. Pharmacists get paid for the drug itself and also for the service they provide to make sure there's no errors, that it's the right dose, right person, right date of birth, work with your physician if there's a problem, insurance. We provide a lot of health care in addition to the drug product itself. And we just, like the patient, want that drug product to be absolutely as low cost as possible. In fact, we don't care if it's free, like if there's not any margin in the drug, as long as there's adequate compensation to provide those services safely and effectively for patients. And there have been some real examples. One of them was shared in that U.S. Supreme Court case where Gillette, Arkansas, lost their only pharmacy. Strong, Earl, Junction City, Plainview, Cedarville. Just in the last year, Magnolia, Arkadelphia, Gurdon, and Danville have lost one or more pharmacies. And that means you're not only losing access to the services, you're losing those trusted relationships with the person who you trust to help you use your medication correctly and effectively.
Okay.
So these laws are important for that reason too, not just the cost of the drugs.
All right. So let me ask you, Booth, did for the amount of effort that you had put in, for the amount of effort the pharmacists had to put in order to be able to get the reimbursement, and I'm sure if I'm a pharmacist and I'm looking at it and thinking $10 ain't worth my time.
And in what they do, and most of them are common sense. And so they're not going to send us a complaint about one or two drugs that cost them $6 or $7. And so typically our PBM coordinator will get a complaint or an Excel spreadsheet with 200 or 150 different claims, prescription drug claims, that, for example, were below acquisition costs that they want adjustments for. And so when we do make adjustments for pharmacies, we said 237 complaints are resolved, but I view one complaint to equal everything that you send us. If it's 200 files, that's still one file for me. So, I mean, most of the pharmacists will send in several hundred, 50 or 60, some of them, prescription drugs. They won't do all that just for one or two drugs.
Okay, tell you what, I got to take a break. If y'all can hang on through the bottom of the hour, we'll come back, and then we're going to finish up our segment with y'all by me asking this question. How does this legislative audit report, how does all this discussion, for us that are in the know and dealing with it, we kind of understand it, we know the direction we're moving it in, but how does it benefit the consumer? Because that's really what Arkansans want to know is, how can we help, or how can this help get their prices down? You're listening to the Kim Hammer Show. If you want to, you can go up to kimhammer.com and download the reports that we're talking about, and we'll be back in just a minute to the Kim Hammer Show. Welcome back to the Kim Hammer Show here on 101.1 FM, The Answer. Again, if you want to, you can go up to the kimhammershow.com website, and there you can pick up copies of the reports that we're talking about today. My guest for the first part of the hour has been Booth Rand with the Insurance Department, and also John Vinson with the Arkansas Pharmacists Association. We're talking about an audit report that came out yesterday in Legislative Audit that legislators reviewed, and both Booth and John were key contributors to the conversation yesterday. I do want to remind you that Wings Over Bryant will be coming up on June 19th. You can get your tickets at any Big Red store here in Arkansas. And like I said, if you can't find a Big Red, it's like saying you can't find a Dollar General. You probably don't need to be driving on the road. So go by Wings Over Bryant and pick up your tickets for what is going to be a great weekend down in Saline County, there at the Saline County Airport located in Bryant. All right, so when we left off the last half hour, we were talking about pharmacists made me afraid and the number of complaints coming in. And I'm going to get to the question of how does all this relate to benefits to the consumer. But let me go back to you, Booth, and just ask you this. Do you think that you're going to see the number of complaints coming down from pharmacists because of what we've been able to do legislatively, getting PBMs in line? And as a result,
I think it's going to go up, not down, as more and more pharmacists reach out to the insurance department and start developing relationships with the state agency that governs and regulates the PBMs and disciplines them, that binds them. I think we're going to see more pharmacists file complaints. We're certainly already seeing that. I mean, we've already gotten several hundred already this year, compared to 220 the last year. So we're growing in terms of complaints. And I certainly encourage pharmacists that are listening to this to reach out to us. And if you've got questions or violation issues, well, reach out and tell us about it. We want to know. We don't want to just sit here and not do anything. So I think you're going to see the pharmacists reach out and make more complaints than what we've been seeing. I think the report will probably trigger more complaints than less.
What about consumers? Are they the ones that should also be calling in, or are we leaving it up to the pharmacists to call in because it deals with the reimbursement?
Well, I think in my opinion, the pharmacist is going to know more about whether they got an anti-gag clause going on, or whether they've got a PBM that's not paying the invoice cost of the pharmacist, and so it's a lot more pharmacy driven. But at the end of the day, what benefits the pharmacy benefits the consumer, as John pointed out. So I'd let John speak to that. But I think to the extent that we benefit pharmacists, we benefit consumers who participate with those pharmacies.
Yeah, two things real quick. One is I agree with what he said, but the insurance commissioner does have rulemaking capability too if they identify new issues within the existing licensure act they have. So one emerging act that is very consumer focused is whether or not it's fair or right for improper steering or, is it advertising or is it steering in the way a middleman may try to drive a patient or force a patient to a particular pharmacy owned by the PBM. There's conflicts of interest in there, and that was discussed. And we've got some new legislation this year. The second thing is, and I just want to make this clear for consumers, I talked a minute ago about a bunch of cities where there's no health care left and they were driven out of business. Declining reimbursements because of PBMs to pharmacies has been happening for the last 30 years. But but most of the time that savings or that discount is not passed on to the patient, so they never see lower prices. It's just siphoned off by middlemen for profit. But it really got egregious in the last 10 years, particularly right before 2015, after the federal government started letting insurance companies and pharmacy benefit managers and pharmacies and mail order pharmacies become one company. And when they become one company, it becomes the fox guarding the hen house. And if pharmacies are pushed out of business because of low reimbursement, then those PBMs are hoping those patients then use the pharmacies they own, which then means less competition and higher prices. So we want a fair, competitive marketplace that allows free competition between providers and not a broken marketplace where a large company is able to steer all the business to itself at higher prices.
All right. Tell you what, I'm going to wrap it up because I've got Dr. Charisse Childers on with Department of Workforce Services coming on after y'all. I'm just going to make this final comment, and if you want to get a copy of this audit report, and one thing, we as the legislative branch decided to hold this audit report over till next month because we have some folks that we want to bring back in to kind of take this to the next level. But on page 3 of the report, it says, through all these practices, PBMs can use their intermediary role between pharmacists and third-party payers to increase profits. I think that's one thing that we're going to be taking a look at as we continue to press on with this issue. Let me just ask each of you gentlemen, any parting words? Booth, you got any parting words you want to share?
No, I just want to reiterate my sort of theme this afternoon, which is to encourage pharmacies to reach out to the insurance department in case they've got questions about violations by PBMs. And we have a PBM coordinator in the division that's dedicated toward helping pharmacies get answers that they deserve. So I just want to encourage that and call the legal division at 501-371-2820 in case you have a PBM complaint. We would be more than willing to look at those. 371-2820?
Mm-hmm.
Okay, 378. 2820.
371-2820.
Probably most pharmacists know that, but anyway.
Yeah.
All right, John, final comment?
I just want to say that pharmacists of Arkansas remain one of America's most trusted healthcare professionals, and we've been there through the COVID pandemic, delivering services, not batting an eye. Even our pharmacies have remained open. Our hospital pharmacists have provided services there as well. And we've recently been administering the COVID-19 vaccines as well as other services that are needed in the pandemic. And I think this is a really strong case, an example of where that trust is real. And not only do we want to operate our businesses and provide services, but we are the eyes and ears for our patients. And we will continue to advocate for truth and transparency that benefits and aligns the incentives for not only the state and our pharmacies, but most importantly, the patients we serve. So we're very appreciative to be part of this policy discussion. Thank you for having me on the show today.
All right. Thank you, gentlemen. Hope you have a great rest of the Saturday and a good weekend. I appreciate you coming on the Kim Hammer Show. Finally, you can go up to the KimHammerShow.com website, get a copy of that audit report. We'll have it back up in front of the committee on August 12th will be the next time we'll meet. We're going to bring some folks in that have some questions they need to answer so we keep diving into this. So I appreciate very much Booth Rand, Managing Attorney for the Arkansas Insurance Department, being on. Also, John Vinson, the CEO of the Arkansas Pharmacists Association. We're going to take a quick 30-minute break, or 30-second break, sorry. Take a quick 30-second break to talk about Wings Over Bryant. Listen attentively. We'll be back with Dr. Charisse Childers to talk about unemployment here in the state of Arkansas.
Coming to Bryant, Arkansas, Father's Day weekend. It's the Arkansas Heart Hospital Wings Over Bryant Air Show, June 19th at the Saline County Regional Airport. Kids 12 and under get free gate admission, and there's something to do for the entire family. Some of the top acts in the country will be on hand, including Warbirds in Action, the Texas T-Carts, and Team Aeroshell. Tickets on sale now at all Central Arkansas Big Red stores or online at wingsoverbryant.com. Treat your dad to a fun family event June 19th.
All right, welcome back to the Kim Hammer Show here on a beautiful Saturday. Thank you for joining us here on 101.1 FM The Answer. Now I'm bringing on for my next guest is Dr. Charisse Childers, and Dr. Childers' official title with your agency over there, please.
Hello, Senator Hammer. This is Charisse Childers, Director of the Division of Workforce Services in Arkansas.
Very good. You've been on the show before. I appreciate you coming on, especially on your time off, or you probably don't get a lot of time off right now, I know, so I appreciate you taking time out to be on the show. Let's just kind of give the people an update of where we are as far as unemployment in the state of Arkansas. How many unemployment claims do we still have there? Just kind of give us the numbers that we're dealing with today.
Yes, sir. As of May 29th, we had 2,226 initial claims. Compare that to last year at this time, we had 8,481 claims. Prior to the pandemic, we had 1,360 claims that week prior to the pandemic. So we are seeing initial claims drop. We still have continued claims, obviously, those that are receiving unemployment benefits and continuing their claims week after week. And those were at 18,996 as of week ending May 29th. Now, that is just for regular unemployment benefits. Under our Pandemic Unemployment Assistance Program, last week ending 5/29, we had 916 initial claims with 42,744 continued claims. Obviously, we didn't have the Pandemic Unemployment Assistance Program prior to the pandemic, so those claims have been changing based on the situation with the pandemic and also with the ability of those individuals that were once self-employed and gig workers and their ability to go back to their previous jobs and employment.
So let me just kind of run down a list of questions that I get asked and give you a chance to respond. So those folks that were self-employed but unemployed that have yet been able to return to work, is there still assistance out there for them? And I know the system got backlogged. It was kind of a perfect storm moment. But what about for those that have not been able to return to work yet in the field of which they were self-employed? Where are we with them?
Senator Hammer, to our knowledge, everything is open back up, and so those that were previously considered 1099 employees, those opportunities have opened up in either their previous employment and or jobs, or those individuals have found other employment opportunities, and that could be that they've now gone back to W-2 jobs instead of the 1099 jobs that they had prior to the pandemic. So we are offering employment assistance to these individuals as the governor directed us to provide maximum job search assistance. We're doing that through our local workforce centers, and that's for individuals on regular unemployment and those that were on or are still receiving pandemic unemployment assistance, so we can help them get back to work if they need additional training, skills, or just need to know where the jobs are. Okay.
And, you know, one of the big things I hear on the street in talking, you just got to follow social media and just keep up with the news, real or fake, either one. Keep up with the news, and that is that there is a demand for employment right now that employers are screaming for people to work. That, in some cases, restaurants aren't able to open back up, or they can't open back up at full capacity. There's still a demand backlog for employers to find people to work in the industrial setting. Do you find that to be a legitimate concern, or is that just hype, or what are you finding in your position as you work with employers matching up against employees?
Well, what we're hearing from employers is that there is still a significant need in our system that we have for job postings. We have over 40,000 job vacancies currently in Arkansas. I hear that numbers are higher if you were to go to another employment site, such as Indeed.com or others. They're showing even more jobs than we have posted in our America's Job link. So what we're hearing from employers is that they're offering bonuses, they're offering opportunities for individuals to have additional assistance for things such as sign-on bonuses, additional dollars for training, additional dollars for other child care and so forth that might be barriers to those individuals or hinder those individuals from being able to go back to work. Also, it's an incentive for those that are looking for jobs. So we're hearing a lot of that, as all of us are hearing on the national news. This is happening all across the country, not just in Arkansas. As far as employers and what they're finding with the current status is they're not able to completely open up because they can't find the employees. They don't have the employees that they need. So that is something that we're hearing. We're also hearing about the rate of turnover from these companies. So they're having significant turnover right now with the individuals that are coming back to work or with their current employees. Some of that is because the current employees are finding other opportunities since there are so many jobs out there, so they're able to move into a career path that provides them with the higher wage, or they're just burned out in the current job that they're in because most of them are having to do more work because of the lack of supply of employees, or the lack of actually the filling those jobs, so they don't have support, and so they're burning out. But it's also an opportunity for employees to go and move up the career ladder because there are so many openings right now.
What is the current unemployment rate in Arkansas right now?
The current unemployment rate is 4.4%. And the rate for May, that's for April. For May, the rate will come out on June the 23rd.
All right. And pre-COVID, what was our unemployment rate before all this mess started? You remember?
Yes, sir, 3.4%.
So we're not far off being back where we were pre-COVID. And when the numbers come out, I'm sure that gap will probably close. Who knows? It may even get down close to the 3.4. With the number of jobs vacancies that are posted either from your site or from the other sites out there that you monitor, do you think that we'll even actually go below where we were pre-COVID, or with the $300? And we'll talk about that in a second. And I do want to commend the governor on his leadership. I know he got legislative support for the decision, to pull out of the $300 week program. Do you? Just your best educated guess, you think we're going to get down below where we were pre-COVID?
Senator Hammer, I have no idea if we will or not. Obviously, there are a lot of factors that are considered there. It has to do with how many people are actually seeking employment and how many are currently unemployed, and that number has it includes a lot of factors that I wouldn't even begin to guess. But I do expect that we will continue to see our unemployment rate drop. But we also hope that individuals that currently are not either seeking work or not, and they're not on unemployment, that those individuals will become part of the labor force. And so I think there's a lot of variables there that are unknown at this time, but we're happy to see the unemployment rate continue to decrease, and we are doing everything we can through our local offices and through our mobile workforce units to support employers and help them interview, provide job training, and get people into positions. So I encourage any employers that need assistance to please reach out to your local workforce center, and then also request that the mobile workforce unit come to your place of business if you're doing any job fairs or any on-site employment activity.
Okay, one area we've talked about, because it gets under my skin, is when an employer calls an employee back and the employee does not come back and is offered that job. And, you know, the common discussion out there is that you make more money staying home than you do actually getting out to work with the $300 subsidy, which is going to go away the end of the month. So what about an employer who calls an employee back to work or offers somebody a job and they say, no, I don't think I want to come back to work right now? What is the recourse for the employer, and what can they do so that we can work to cut off that person's unemployment? Because if they got a chance to get a job, they ought to go work. But if they don't, I don't feel that we need to continue to subsidize them with government assistance, given the opportunity that the work environment is getting better. What can that employer do?
That employer can use the Tax 21 system to report that information. We have a fillable form on our website, so they can go to our website and report that information. They can report it online. They can use their employer form that's on our website, or they can call our office. We encourage them to report those individuals that have refused a job, that did not show up for an interview, and that are obviously not actively seeking employment. We appreciate the support and the help from employers, because it is important that everyone return to work and that we support our employers so that we can completely open up to all the citizens of Arkansas.
Do you get a lot of employers that are taking advantage of that, or do they feel it's just, hey, that's too much headache, just forget it, I'm gonna move on down the line? Or what kind of participation do you get out of employers on that?
The numbers are increasing, and we're hearing more and more employers reporting that. We realize that it is a burden on the employer to do that, because obviously they are already busy with just trying to keep their positions filled and recruiting employees and performing the services and delivering the products that they're charged with doing. So we know that it's a burden for employers, but we've tried to make it as easy as possible, and we're seeing an increase in those reports.
If you'll email me all that information you gave me about how employers can do that, I'll put that up on my website, thekimhammershow.com. And if you're listening, you can go up there and get that information, because I would encourage you as an employer, if you got somebody that has turned down a job, that you need to report them so we can get them off the system. I got two things left in the 4 minutes I think we've got left to talk about. The $300 going away, just talk about that real quick, how that's going to impact somebody that's on unemployment. Just talk about that for a minute or two.
Okay, so the regular unemployment programs will continue. Those individuals that are eligible for regular unemployment, just like in the past, will apply, and their applications will be processed and will continue for the up to the 16 weeks that the state allows for our current regular unemployment system. The letters went out to the individuals receiving all of the other federal programs this week. So those individuals are being notified that the federal programs are terminating on June the 26th of 2021. So those individuals will receive a letter in the mail, and it's also been put out through social media and our website, et cetera. Those individuals will receive that notice to terminate, and that information will be shared with them. Their last week to do their weekly claims. will be that week ending June 26th.
Okay.
Those individuals that have back weeks or their claim is in adjudication or appeals, we will continue to process those if those individuals are determined to be eligible. So anyone who has their claim in a status currently of adjudication or in appeals, if they're deemed eligible, those claims will continue to be processed at that point. And so those individuals will continue to receive information from us regarding their claim and their status, and also their hearing date if they have if their claim is in the appeals process.
All right, real quick, because I'm down to like 3, I think Russ is telling me. So you guys are actually upgrading the software system over there because it was kind of a perfect storm whenever all this hit. Our software system was not quite up to speed, but y'all are working on getting that fixed so that, God forbid, this should ever happen again, will be a smoother transition.
Yes, sir. So the legislature approved a funding mechanism to provide support for a new unemployment system. So we have already started working on that RFP, and that will go out in the next couple of months, and then we will be looking at acquiring a vendor to build that system. Unfortunately, that does take time to do the process and also to build the system. So we will be using our current system for the next couple of years.
Okay, and then final thing, I got like 30 seconds. You guys are auditing individuals that have drawn unemployment or that were self-employed, and you are in the auditing process. Is that correct?
Yes, sir. Those programs all require sufficient documentation for the pandemic unemployment assistance, and then through the regular unemployment assistance, that audit and that information is provided by the employer. So that all claims and all of the information that's submitted is reviewed and audited.
All right, I got to go. I got like 15 seconds. You've been listening to Dr. Charisse Childers, Director of Department of Workforce Services. If you're unemployed, you might want to get out and find a job. If you've been cheating the system, they're coming. So thank you for listening to the Kim Hammer Show. Remember, Wings Over Bryant on June 19th. That's a good day for a family event. That's Father's Day weekend.